Hey everybody, I'm Marybeth Chappell, and today we are going to be talking about a job analysis and that of a registered nurse. We're going to understand the critical role of the registered nurse in healthcare and their responsibilities and required skills and work environment. RNs play a critical role in patient care, acting as the backbone of healthcare delivery. Registered nurses carry out essential tasks such as patient assessment, care plan development, and medication administration. Required skills needed to be an RN are a blend of technical skills, empathy, and strong communication to be able to excel in their roles. They work in dynamic settings from hospitals to community clinics, adapting to various challenging and patient needs. Next, we're going to talk about what a job analysis is and how and why it's important. Okay. What is a job analysis? It's a detailed study of a job to pinpoint its essential aspects. It's a roadmap that highlights duties, responsibilities, skills, and knowledge of the working environment and of the working environment. The purpose is to understand what a job entails, determine what qualifications and skills might be needed for the specific job you're looking in, assistance in recruitment, training, and performance evaluation. The key components are job, tasks, and duties, required skills and qualification, and work environment and conditions. These elements are crucial not just for understanding the job role, but also ensuring that we have the right people in the right positions to be able to enhance the quality of care in a healthcare environment. Okay. Job role overview. An RN is going to do patient assessment. They're going to conduct physical exams and obtain health histories. They're going to make care plans for their patients. They're going to create and implement individualized care plans. They're going to administer medications safely, and they're going to give them the right ones, hopefully. They're going to monitor patients, document their vital signs, symptoms, treatment, and responses to the medications treatment and their symptoms that they're having. This involves performing physical exams and gathering detailed health histories from patients. It also helps patients, the nurse, to be able to understand what patients' underlying health issues and conditions are. Continuation of that, registered nurses are always also in charge of evaluating and managing patient care plans. They work with other nurses and medical professionals to provide comprehensive care to patients. They counsel patients and family members on disease prevention and health maintenance. And they take IVs, they start IVs, take vitals. Nurses do way more than what's on this paper, but that's just a general idea of the job description of a registered nurse, because you couldn't fit everything up there. It's just impossible. To become a registered nurse, you need a nursing degree, either an associate's or a bachelor's. They're now pretty much wanting you to have a bachelor's because it's a broader, better degree. You have to pass the NCLEX RN exam. Probably not saying that right. I'm not a nurse. I'm not sure. They need critical thinking, empathy skills, strong emotional intelligence. You can't be weak and be a nurse. You gotta have your emotions in check and keep everything together. You might need basic life support, CPR, or other certifications to keep staying current on your licensure from nursing. The work environment. RN's work environments are hospitals, community settings, doctor's offices, outpatient, inpatient. It can be really fast paced or really slow paced, depending on where you decide to work at. If you're working in a hospital, obviously it's going to be a lot more faster paced than, say, a doctor's office that doesn't see as many patients and it's not emergent and that kind of stuff. Each setting, has a different level of experiences and challenges for each nurse. Quick thinking, obviously, in the hospital is going to be a must. Critical thinking, empathy, for any setting, but most definitely in the emergent type settings. Registered nurses advocate for their patients. They educate their patients and their conditions. They adapt to care plans. They're flexible. Each patient situation is different, requiring them to be proactive, to be able to give the level of personalized care that is needed to do this job. Educating patients is another key part of their job so that they can have knowledge, their patients can have knowledge to better themselves with whatever chronic illness or maybe not chronic illness they may have. If there's a bigger health team, the nurse will kind of be the go-between the two, all the doctors, and like a liaison, if you will. The interdisciplinary collaboration, RNs partner with physicians, pharmacists, therapists, and others. It's important because they offer clinical insights and coordinate care, and you have to be able to promote efficient communication in a collaborative environment, so that the patients feel safe and that you know what you're doing. You're doing your job correctly. Nurse management. Okay, so there's going to be like a registered nurse and then a nurse manager. And then the nurse manager is going to be over a specific department or unit and oversees the budget, resources, and quality patient care. While the charge nurse is going to be your first point of contact, handles patients' assignments, coordinates care, and manages immediate issues. That's your go-to woman or man. And then director of nursing could either be like, I work at a community college and there's a director of nursing that's kind of like the chair over all the nursing. It's a wide span, they're over all of that nursing, wherever that might be, a hospital, community college, wherever. Each of these are important, but it's just kind of an idea of the hierarchy of the different positions in nursing. Why are accurate job descriptions important? You need to be able to define the roles, responsibilities, and performance expectations. What am I really getting myself into with this job? You need to be able to support recruitment by outlining key qualifications and skills, to be able to guide evaluations and training for professional development and ongoing professional growth, to make sure that RNs are ultimately meeting healthcare demands. Robertson says without updated job descriptions, workers are likely to lack role clarity and the effectiveness of important human resource management. Functions will be hindered from that. You got to know exactly, during recruitment, these descriptions are crucial. They outline, key qualifications and skills, ensuring that this is the right job for you. Nursing, you really need to make sure that this is the right job for you. Ultimately, RNs are key to quality care. Everybody says they're really the go-to, not really the doctor, the nurses. Our registered nurses directly influence better patient outcomes. Nurses don't get nearly as much credit as they deserve. They are advocates for patients. They work as a team always, and they carry out essential clinical duties. Their role directly supports better patient outcomes. I said that. RNs are key to quality care through advocacy, teamwork, and their duties. And if you have accurate job descriptions, they align with roles with the healthcare organization, and they promote excellence. All right, thank you. Have a good night.